Rex on Call.
We're looking at the heart pumping.
Take an inside look at the latest in medical technology, treatments, and health trends.
Surgery with that extra edge.
Physicians are a phone call away, and Rex patients share stories.
I was ready to find out, what was really wrong.
And medical breakthroughs.
We're North Carolina's first bionic couple.
Stories like yours, doctors answering your questions with expertise and compassion. We're live now with Rex on Call in the NBC 17 studios.
They don't think it'll happen to them. It's never happened to someone in their family or their friends, and so they're shocked by the diagnosis.
I remember when I found out, I just picked up my son Dylan and just held him, and I couldn't even tell anyone.
It was an immediate thought of, I have to fight this because I have 2 reasons to live. I have two reasons to live, 2 little boys.
Cancer patients are mothers, fathers, friends, and co-workers of all backgrounds. The disease is a humbling denominator. But physicians at Rex and UNC also share a common purpose: to fight cancer. Good evening and welcome to Rex on Call. I'm Melody Hunter-Pillion with Rex Healthcare. You've no doubt seen recent news reports concerning an unsolicited bid to buy Rex Healthcare and response from Rex and UNC that Rex is not for sale. The partnership between Rex and UNC provides great benefit to the community, Rex and UNC say. Well, one key area of that partnership is fighting cancer. Oncologists at Rex and UNC are collaborating to provide the latest in cancer diagnosis, treatment, and clinical trials. In a moment, Rex and UNC oncologists, along with a cancer survivor, will take your questions about cancer and about the benefits of the Rex and UNC partnership. To call in live to Rex on Call with your cancer detection, treatment, and prevention questions, as well as questions and concerns about the partnership, you can just dial the number at the bottom of your screen. That's 1-888-309-7437. Again, 1-888-309-7437 with Rex on Call. Our operators are standing by to take your calls. You can also submit your questions via Twitter. Just log on to twitter.com/Rex on Call, and you can send us a tweet. We'll get to your questions in just a moment. But first, Rex and UNC physicians work together in many areas to provide North Carolinians with easier access to specialty care for cancer, gynecologic health, and pediatrics. Receiving highly specialized treatment just a little closer to home makes a difference.
Keep blowing, keep blowing, keep blowing, keep blowing. Don't stop, don't stop. Now stop. Good job.
Respiratory therapist at the North Carolina Children's Specialty Clinic in Raleigh, an extension of the North Carolina Children's Hospital in Chapel Hill, checked Trey's lungs with these pulmonary function tests. This Robinson County family sought special treatment for Trey after what they thought was simple bronchitis took a sudden turn.
Once they did the x-ray, that's when they found out that his left lung had collapsed.
Then they put me in the helicopter.
What we found was a significant mucus plugging in his left lower lobe that required several procedures called a bronchoscopy to remove that mucus.
Pediatric pulmonologist Dr. Seela Laughlin and a team of specialists here care for children with complex and highly specialized health needs. U.S. News recently ranked North Carolina Children's Hospital number 6 in the country, including a top 10 ranking in pulmonology.
It's a blessing. We have people come from all over the state to see us. It is an amazing resource. We have specialists in cystic fibrosis, primary ciliary dyskinesia, very rare things that other centers don't have access to.
More easily accessible now with the North Carolina Children's Specialty Clinic on the Rex Hospital campus in Raleigh.
It makes a huge difference not having to have that extra hike to Chapel Hill. And so I think we've opened up the number of appointments that are available. Here we've been able to get patients in within a week of their primary care physician calling. And so it has given us a great opportunity to get more kids in and seen faster. And then it also opens up space at Chapel Hill.
That same type of highly specialized care from UNC physicians at Rex is available in the area of gynecologic health and specific areas of cancer treatment. For cancer patients undergoing radiation treatment, UNC radiation oncologists provide the care at Rex, along with members of the Rex Cancer Center team. UNC Specialty Women's Center at Rex offers services in gynecologic oncology, reproductive endocrinology and infertility, maternal fetal medicine, urogynecology, and reconstructive pelvic surgery. At UNC, Dr. Matthew Ewand and other specialists use the CyberKnife to treat brain cancer and cancers in other sensitive areas with targeted precision. UNC is one of the few CyberKnife systems in the state.
and it has a small or miniaturized linear accelerator attached to it. The robot is powerful enough to move the linear accelerator all around the patient, and that means that the radiation can be delivered from many different angles with tremendous accuracy.
UNC Specialty Women's Center at Rex offers services in gynecologic oncology, reproductive endocrinology and infertility, maternal fetal medicine, urogynecology, and reconstructive pelvic surgery. Again, there are many areas where Rex and UNC work together, and tonight our focus is cancer. And joining me on set is Dr. Jeffrey Crane. He's medical oncologist with the Rex Cancer Center, and UNC gynecologic oncologist Dr. Linda Van Lee, who sees patients both at UNC and at Rex Healthcare in the UNC Cancer Specialty Center at Rex. Also with us is cancer survivor Eileen Thompson. And Eileen, thank you for being with us tonight.
Well, thank you.
Tell me first, share your story with us of exactly what cancer you were diagnosed with and sort of what course your treatment took. You look lovely, by the way, tonight.
Well, thank you. Thank you. I was diagnosed with breast cancer in March of 2008 by routine mammogram at Rex Hospital. The radiologist obviously noticed something irregular and sent me to a surgeon upstairs. I had a lumpectomy. The surgeon called and gave me the diagnosis of a malignancy, and he said, "Where do you want to be treated?" And without hesitation, I said, Rex Hospital.
And you are being treated at Rex, or receive treatment at Rex, and
right.
now also part of a clinical trial at Rex, but through UNC, is that right?
Right, through UNC. It is evaluating the role of genotype in tamoxifen-treated breast cancer patients. And I am on that trial, I guess, for the next several years. I've been on there, well, a total of 5 years.
And Dr. Jeff Crane is your medical oncologist over at Rex Healthcare. Dr. Crane, just tell us how important those clinical trials are, and is it more accessible now that Rex and UNC are together? Is it more accessible for more patients in the Wake County area and eastern North Carolina coming to Rex for those trials through UNC?
I think in the last 5 years, as we have grown the program between UNC and Rex, one of the most telling points has been our clinical research. Until we cure cancer, a clinical trial is almost always the best and most preferred approach to cancer treatment. So we're looking not for just cures, though. In cases such as Eileen's, we're looking at how we can improve the quality of the treatments that we're giving, selecting patients more appropriate for those for the treatments with a higher chance of good outcome, and to diminish the toxicities. So if we can diminish toxicities, improve the outcome, and along the line learn ways that we can improve our cure of cancer, it's a win-win situation.
Okay, and of course Eileen's cancer was breast cancer, but Dr. Van Lee, your specialty is gynecologic oncology.
That's right.
And that type of cancer, so we definitely are going to take some of those questions tonight as well. But can you tell me why we have you here tonight, if I read somewhere that 1 in 4 women will have some chance of developing some type of gynecologic cancer in their lifetime. Is that pretty true, or is that a myth, or?
I guess all women are at risk for developing a gynecologic cancer. However, I think that number is a little bit high. If you look at the number of breast cancers, colon cancers, and lung cancers for women, those surpass our numbers greatly. And that's one of the problems why we have trouble developing the correct screening, the correct therapy. For example, ovarian cancer, one of our most lethal cancers, is because it's really, the incidence is 1 in 70 in the population. So 1 in 4 is a little bit high, but all women are always worried about gynecologic cancer, I think.
All right, so when we come back, I want to ask Dr. Van Lee some specific questions about symptoms of cervical cancer, ovarian cancer. Dr. Crane's going to talk about breast cancer and also prostate cancer. And Eileen's going to share some more of her story and her treatment and how she decided with her physicians what course of action they would take. So we're going to have more questions from our viewers when we return, and answers from Dr. Crane, Dr. Van Lee, and Eileen, making you a doctor here, Eileen. You probably feel like one by now after what you've been through. While we're in the break, call our phone bank and ask your questions about cancer screening, treatment, prevention, and also if you want to ask about the partnership between UNC and Rex. That's 1-888-309-7437. Stay with us.
Patients can expect to receive the most modern, up-to-date, innovative, imaginative, and technologically sophisticated care possible.
By virtue of the relationship between UNC and Rex, we're able to do that.
Keep doing what you're doing, because you allow people like me to continue living, and that was truly a blessing.
tissue.
I have a magnified view. I can see all the blood vessels. I can navigate around things that are typically difficult for me to see when I do traditional surgery.
This is Rex on Call live on NBC 17, giving you an insider's view of Da Vinci robotic surgery in the Rex Hospital operating room. The surgery you see is being performed by UNC gynecologic oncologist Dr. John Bogus, and he does perform those surgeries at Rex Hospital. He's world renowned for his talent and skills in helping the women at Rex as well as over at UNC. We are taking your questions on cancer screening, risk factors, prevention, and treatment, as well as any questions or concerns you have about this unsolicited bid for someone to buy Rex Healthcare and the partnership between Rex and UNC to bring benefits, especially oncology benefits to patients all over the area. So if you have a call for our oncologist, Dr. Jeff Crane is here, medical oncologist with the Rex Cancer Center, Dr. Linda Van Lee, who is a gynecologic oncologist at UNC, and also we have a cancer survivor. And again, thank you, Eileen, for being here with us tonight.
Thank you.
So Eileen, yours was breast cancer, and you said it was found through the mammogram.
A routine mammogram.
Exactly. And so, Dr. Crane, if I can just quickly get to the fact that we saw a lot of different news reports over the last, say, 12 months about mammograms. What age were they necessary? Some recommendations to move the age up, and then some recent information about perhaps maybe that recommendation is not such a good idea. Where are we on that, and where do oncologists stand with that?
It certainly has been a flurry of activity, and you wouldn't be surprised to find people mixed up about it. I would say that right now, and probably as recently as 2 weeks, I think the most recent review of this data would support that women should get mammograms, preferably starting at age 40, but certainly no later than 50. There are a number of pros and cons, and I think people cite what's called the USPTF study of 2010 as a reason not to. However, I can say that a number of leading thought centers have put together a study and published in this last week's literature, medical literature, that would support that mammography reduces the death rate from breast cancer in this country and the world.
Eileen, and I don't know if ladies have been asking you about this, but certainly you must have some strong opinions about the mammography and how necessary it is.
Oh, I do. I had a routine mammogram in 2007. I'm over 50, so I have one every year, and it was totally clear. At exactly 12 months later, I had another, and that's when my cancer was detected. So if I had skipped that mammogram and had waited another year, I don't know that I would be sitting here today. I mean, you don't know.
Right, and exactly. And Dr. Crane and Dr. Van Lee would certainly say that early detection is really a key in successful treatment. You would both say that for any type of cancer.
Yes.
And Dr. Van Lee, let's talk some now about gynecologic cancer, if we can, and cervical cancer. What types of symptoms would women have who may have cervical cancer?
So first of all, we really do not want to have cervical cancer in this country, and so the HPV vaccine will help. The Pap smear, my goodness, if all women would avail themselves of the Pap smear similarly as they would have their mammogram, we would have a big impact. So unfortunately, the symptoms of cervical cancer are irregular bleeding, and it's hard to tell apart from menses.
Right.
Some discharge, odors, and by that time, unfortunately, it's pretty late. So if I could make a plea for everyone to get a Pap smear, we would probably get rid of that disease in this country.
What about ovarian cancer? Would the symptoms be somewhat the same, or are they very different?
Ovarian cancer symptoms are different, and our specialty is trying to develop a symptom list, so to speak, of early symptoms, abdominal symptoms that are very specific. And we're working on that, and we're not quite there. Again, unfortunately, there is no effective screening for ovarian cancer, but we're working really hard on different algorithms using ultrasound, CA-125. I would put the message out there that, screening yearly with CA-125 is not very helpful.
Okay.
So we don't have a good screen.
Dr. Van Lee is being very modest. I think it may not be well known, but her department at the University of North Carolina is, I think, certainly nationally known as one of the finest centers for GYN oncology. When you talk about thought leaders, it's not just one or two people there. There is a staff there that brims with international talent. And one of the things that's happened at Rex that's been so nice is that over the first 3 or 4 years we talked about it, laid a lot of plans, and now finally we have these people across the hall, so that when my patients need to see a world's expert, I can literally walk 15 feet.
Yes, and one of those experts is Dr. John Boggess, who performs robotic surgery for gynecologic cancer. And here's a piece with Dr. Boggess.
Is it up?
A surgical team, a robotic machine, and a skilled surgeon, Dr. John Boggess, who commands the robot and its precise movements from a console. It all comes together during a morning hysterectomy in the Rex OR.
All right, let's pull up the balloon.
I have a magnified view. I can see all the blood vessels. I can navigate around things that are typically difficult for me to see when I do traditional surgery. With a computer system in it, it eliminates tremor, for instance, so it actually smooths out the motion. And we have wristed instruments just like our wrists, but everything is miniaturized and magnified, and it's all introduced inside the patient's body through little tiny incisions. And what that does for patients is I can still do the same operation I would traditionally do, but now I can do it with less trauma to the patient. So they lose less blood on average by a significant margin. So that means fewer blood transfusions, less fatigue after surgery, so they're recovering more quickly. Their body's not putting resources into making up for that deficit. It's putting resources right into healing.
Josh, go ahead and switch that needle driver over and get me a stitch.
On average, by 2 weeks, most women that we treat are 80 to 90% back to normal. And that's in contrast to the old-fashioned way, where it's more 6 to 8 weeks with soreness that can last up to 6 months.
As a gynecologic oncologist, Dr. Boggess uses robotic surgery for women who suffer from uterine cancer, cancer of the womb, cervical cancer, or the cervix.
It's kind of neat.
This special robotic surgery that Rex Healthcare we have will, and the multiple disciplinary care will continue when the new North Carolina Cancer Center hospital, that is, for North Carolina opens at Rex Healthcare, and that will be in 2014, and we're going to need it. It's estimated that nearly 4 in every 10 North Carolinians will develop some type of cancer during their lives. The new North Carolina Cancer Hospital on Rex's main campus in Raleigh will play a key role in helping a number of those patients find the best treatment. We're going to have more questions from all of you when we come back from the break, and we'll see you in just a moment.
Don't miss the Rex Hospital Open June 9th through 12th. It's the area's only PGA nationwide tour event, and there's just as much action off the course as there is on it. Join us for Dad's Day Out on Saturday, June 11th. Free family fun including mobile video games, Home Depot Kids Craft Workshop, face painting, and more. The Rex Hospital Open at TPC Wakefield Plantation. Get close to the ropes and see the future stars of the PGA Tour. Go to rexhospitalopen.com to buy tickets and for more details.
Rex, Wake County's first choice for healthcare.
Welcome back to the show. We're standing by to take your calls and questions on Cancer Live here with Rex on Call. And we do have medical oncologist from Rex Healthcare, Jeffrey Crane, Dr. Linda Van Lee, and she's with UNC. She's a gynecologic oncologist, and also our breast cancer survivor. She's Eileen Thompson, and they are taking your questions. And very quickly, we wanted to get to this call from Lenita in Sanford. She says she's 61 years old and wants to know what is the recommended schedule for a pap smear if you've always had a normal one. So she wants to know if that's yearly, every 3 years. What would that be, Dr. Van Lee?
Certainly. In the old days, we did yearly. Now we know a lot about pap smears and how they are and how patients are stable. So usually we say after having had sequential normal pap smears, a patient of her age can go every 3 years and stop having pap smears at the age of 70.
Okay. All right. Joy called in from Benson, and she says she had breast cancer at the age of 36, 46 or breast cancer at the age of 36, the mother at 73 who passed away from breast cancer, and her brother had colon cancer. Should they have some sort of genetic testing done? And obviously they have some concerns. So what would you say?
Well, I think that this person with now, it looks like 2 first-degree family members with breast cancer and her own age, first being younger than 40, and then a mother postmenopausal, you could make a prediction that this patient carried the BRCA1 or 2 breast cancer gene, probably higher than the population. Perhaps in this case might be as high as 10 to 12%. So yes, Dr. Jim Evans at UNC has an excellent genetics clinic. It can be. We can vet that or get that through Rex Cancer Center, but that patient should be considered at risk. And of course, even if our patients don't carry the BRCA gene, we still, with that family history, that patient should certainly not miss their mammography.
So, Joy, we hope that that answer was helpful to you. Eileen, when we come back, I really do want to talk to you about how you chose your course of care, if you felt like you were very involved in it along with your oncologist. We want to thank you for your questions, and of course, always have a discussion with your own physician about any health concerns. We're going to have a final round of questions coming right up. This is Rex on Call. Welcome back to Rex on Call, live on NBC 17. And Eileen, we want to ask you, as we're wrapping up the show, just about how involved you were in your care and your treatment once you were diagnosed with cancer.
Very involved. Just a little bit of my background. I've worked in the healthcare industry in the Triangle area for the past 25 years, so I was very familiar with the options here. And the reason I chose Rex was because of the affiliation with UNC, the availability of clinical trials, the multidisciplinary approach that my surgeon, medical oncologist, Dr. Crane, and radiation oncologist took to managing my care. I was very involved. I felt like I truly got personalized medicine at Rex Healthcare.
And how are you doing?
I'm doing great. After a round of chemotherapy and radiation and on tamoxifen, participating in the clinical trial, I feel great. I see my oncologist regularly, and it's really a pleasure to go back and visit the people in the clinic, and great nurses. I can't say enough about it.
Well, you look great, and we continue to wish you well. And we had a call from Bertha, and she just wanted to know or express her concerns about this bid to buy Rex. And I want to ask, just from a physician's point of view, first with you, Dr. Van Lee, if you'll just tell us, why do you feel this continued partnership is important as a physician?
Well, as Dr. Crane alluded to, we really have a wonderful, excellent division of GYN oncology. We have a lot of services to offer. You had a little piece about robotics. I mean, we're well known for that, can offer patients a lot of that. But we're situated in Chapel Hill, and we really feel we need to be able to offer our services to the majority of people of Wake County. And what better place to do it than Rex, because they are our clinical partners. We get along well. We collaborate just great. I mean, it's just the perfect situation.
Yes. And a large population in Wake County, the eastern counties and northern counties surrounding Wake County. Dr. Crane, your thoughts on why this partnership between Rex and UNC should continue for patients and physicians?
I think it's very important. I think this has been a very disruptive bid. I cannot say that it's been helpful at all. The amount of time going into laying a framework for what is just now coming to fruition. Think of if you were a fan of one of the local basketball teams and you watched a group of freshmen come in, and then all of a sudden they were dragged away by some pro team with a lot of money.
Right.
This is not about money. This is a really great team, and we'd like to see the seniors play and win the national championship.
Well said. Thank you for joining us tonight. Always watch us each month with a different health topic. Good night, everyone.